Okay. Looks like we still have a few people trickling in, but we'll go ahead and get started so we have plenty of time. Hello all, my name is Mimi Mudd and I want to welcome you to the second webinar in our summer 2023 family webinar series. I am the Assistant Director for Parent and Family Programs, and I am joined by two of my colleagues from Habif Health and Wellness and also Mental Health Services, also now called Counseling and Psychological Services, or CAPS. So we have Cheri LeBlanc, Executive Director for Habif Health and Wellness, and Tom Brounk, the Director for CAPS. We're excited that you've chosen to join us for tonight's conversation, and we have some information before we get started. So first, we want to make sure you know how to submit questions during this webinar. You will notice that we have been given, we've given you the ability to ask questions via the Q&A feature. Our professional staff within Student Transitions and Family Programs is helping field the questions that you submit. So to make sure you know how to use the Q&A feature, please share the place from which you are joining us tonight, and then we'll name a few of them on air. Second, we'll be showing a PowerPoint created by our panelists during tonight's webinar. However, if you prefer to download this PowerPoint and follow along on your own, please use the link that we'll be sharing in the chat. As a note, in the chat feature, we will be sharing links and email addresses for the duration of the webinar, so always make sure you're referencing that. Third, this webinar is being recorded live. Next week, it will be uploaded to our families.woostel.edu website. In a moment, we'll hear from our panelists about services provided by Habif Health and Wellness Center and also CAPS. If something they say sparks a question, don't forget to send it to us using that Q&A feature. After the presentation, we'll move into the question portion of the evening. We'll be asking our panelists the questions that you all submit. So before passing things along to our panelists, I want to share some of the places from which people are joining us from tonight. So we have Chicago, Illinois, San Francisco, California, and Tallahassee, Florida. Now, since I know you all want to hear more about Habif Health and Wellness Center and also Counseling and Psychological Services, I'm going to turn it over to our panelists to go ahead and get us started.
All right. Well, hi, everyone. I'm Dr. Cheri LeBlanc. As Mimi has said, I'm the Executive Director here at Habif Health and Wellness Center. I've been with the university for coming up to 10 years in August, and really happy to be here tonight with you. And I'll have Tom introduce yourself, and then maybe we'll get started with the PowerPoint.
Sure, and I'm Tom Brounk. I'm Director of Mental Health Services, now renamed as Counseling and Psychological Services Center. I work very closely with Dr. LeBlanc, and I've been here coming up on 29 years.
All right. So Tom and I are going to tag team a little on this PowerPoint, and I'm going to start with just some general information. We really run a very comprehensive care that's integrated, both our medical side and our counseling and psych services. Medicines and psychiatry, as well as health promotion, report up to me, and counseling and psychological services report up to Dr. Brounk. We're located conveniently for first-year students on the South 40 in the lower level of one of the residence halls called Dardick House. You can see our hours of operation there on the PowerPoint slide. And after hours, we have two things: medical emergencies or psychological emergencies as well. Students have access to our emergency support team, which you don't see there on our slide. This is a student-run group of trained, licensed emergency medical technicians. So there are EMTs in the state of Missouri who report up through me. And at any time, if there's an emergency, 24/7 during the academic year on campus, students have access to that team. And then there's, for non-urgent things or non-emergencies, there's also what's called timely care, where students have access virtually to both a medical as well as mental health clinicians. You can go to the next slide, please. So our medical services provide both routine, preventative, and urgent medical care, reproductive health care. We have sports medicine, travel medicine, as well as psychiatry. We have all of our physicians are faculty at the School of Medicine, and they are certified in either internal medicine, family medicine, adolescent medicine, psychiatry, and some have additional certifications in reproductive health, travel, and sports medicine. So well-qualified folks here at the health center to take care of you. We also have wonderful nurse practitioners, physician assistants, our nurses, and MAs, our medical assistants. We have a radiology suite for routine x-ray. We have a lab and pharmacy all on site. So we hope it's a kind of a one-stop shop for all of your medical needs. Go to the next slide. That's you, Tom.
Okay, I think I'll take it from here, this portion. If it's not evident, we do integrate our services very well with the medical and the mental health portions of the services that we provide. We are located in the same facility, and this means that we provide integrated and really comprehensive care. I have a staff of psychologists, professional counselors, and clinical social workers who really provide all the direct service to students. And I can assure you that even when we are closed, we have access to support services for your student. During the day, that's provided by an urgent care counselor, so a student does not have to wait to be seen. They don't have to go through scheduling an appointment. All they need to do is call us, and we will make the time to address whatever the urgent concern is. And in addition to that, we provide short-term. By that, we mean about nine or so counseling visits per academic year are provided at no cost to the student. We provide group counseling on a number of related topics for college students. And then also, I just mentioned crisis response. So next slide. Dr. LeBlanc already mentioned timely care. On the mental health side, timely care provides not only scheduled counseling for students, as well as some psychiatry visits, but they also have a feature called Talk Now. So a student, any time of day or night, whether they're on campus, off campus, while school's in session, or during the summers, have access to a feature called Talk Now. So all they would need to do is download the app, bring up the Talk Now feature of the Timely Care app. They'd be able to be connected to a professional that could assist them within about 5 or 6 minutes. Next slide. We also on campus offer a program called Let's Talk. This is really for students that maybe don't need a full appointment with a therapist. All they really need to do is touch base maybe for about 20 minutes with a member of the staff. So throughout the school year, we'll offer maybe 4 or 5 sessions during the week where students can just go online and chat with a member of the staff. No appointment needed. They don't need to fill out forms. They don't need to be concerned with consents or anything like that. So we really try to make our services accessible. Next slide. Therapy Assistance Online is really a whole host of mental health tools that students have access to. So if they don't want to even talk to a counselor, but they somehow want to address their concern, there are a number of different interactive types of opportunities and videos available on a number of mental health related topics. So a student can really access these all through a self-help set of menu options. I also very briefly mentioned our group therapy program. So we've really been working hard to expand this, knowing that disconnection and isolation is one of the top presenting concerns of students that come into the counseling and psychological service. So groups actually are a great way of being able to connect students on a particular issue or theme that they want to somehow work on, and while also helping them develop connections with others and help to reduce some of the sense of, hey, I'm the only one struggling with this issue or concern. So our group program is actually also another great option in addition to individual counseling. Next slide. Thriving Campus is actually a new resource for students. We rolled it out this last fall. So students, if they don't want to be seen here at the Habif Health and Wellness Center, they can certainly be seen off campus. And our Thriving Campus resource gives students the ability to look at potential therapists in the community that we work very closely with. In some cases, they're clinicians that have worked as part of the staff. But a student could look to find somebody here in St. Louis, or if they're at home, don't want to use the timely care option, but want to find a therapist for themselves at home. This really benefits from the knowledge of counseling centers across the country that are contributing to this Thriving Campus resource. So you'll get somebody that you know has worked with college students in the past. And back to you, Dr. LeBlanc.
All right. So we have a health promotion department that is staffed by a number of professionals with various backgrounds. They work very closely and train both graduate students as well as undergraduate students who are called peer health educators, and really work all year round having events across campus on the various topics that you can see here on the slide. Next one, please. I'm going to talk for a few minutes about the requirements that we have for students to attend Washington University, and immunizations is one of them. As you can see on the slide, all incoming first-year students need 2 MMR vaccines, that's measles, mumps, rubella, after the age of 1, a meningococcal vaccine after their 16th birthday, and depending on the answers that every student has on what's called a TB screening tool, if they're thought to be at risk for TB, a TB test within 6 months of matriculation is also required. We highly recommend COVID vaccines and to be up to date on its boosters, as well as an annual flu vaccine. Meningitis B, which is different than the meningococcal vaccine that is required, but meningitis B vaccine is also strongly recommended by us, as well as the other vaccines that you see there on the slide. And all of these vaccines are available at Habif. If you've been on our website, I want to point out that last year and the year before, COVID vaccine and flu vaccine were requirements. As of July 1 of this year, they will become recommended vaccines. So it's a little confusing if you've gone to our website, because we can't change the actual wording until July 1. But for your students and coming in for the fall semester, while COVID vaccine is not a requirement, we really strongly recommend that you have it. And we recommend that you upload your vaccine information, including any vaccine that you've had, not just the requirements. It just allows you to have a much more complete medical record. The thing that is underlined here on the slide is important, because if you do not have, if we don't have a record of these immunizations, you won't have access to your dorm room. So please be sure to do that this summer. We really want to be able to make sure that move-in is smooth and easy. And so upload your immunization as well as what's called a health history. And you'll find all of that by going to our website. You'll see a tile there that says requirements. Click on there. It'll walk you right through how to do this. Okay, next slide. Mandatory health insurance, that's another thing that is required for students at Washington University, and all students are automatically enrolled in our student health insurance plan. This plan is underwritten by United Healthcare, and it actually has international coverage. What you see there on the slide are what the premiums are expected to be for this upcoming year. We are still waiting for the Missouri board to finalize this for us, but usually comes through the end of this month. I've never seen it change. But that is what we expect will be the cost for the year. This goes into effect August 1st. So actually before students arrive, it is effective August 1st through July 31st. You can go to the next slide, please. This slide just tells you a little bit more about the insurance. It's very comprehensive. It's fully compliant with the Affordable Care Act. The thing I think is most important, that's on the next slide for waivers. But again, if you have the student insurance, you're expected to see Habif. We are your primary care. We are the gatekeepers of this particular insurance for you. And referrals will be needed for specialty care unless it's an emergency, or some of the other options there you see on the slide, if it's OBGYN related, mental health related, or any care that's 50 miles outside of St. Louis, a referral is not required. So if you're home and you're using this insurance, you don't need to talk with us. We don't need a referral for that. But when you are on site, we want to work really closely with you and be sure you're getting to the appropriate people for your care. Next slide. Waiving out, that's what I was going to talk about. So if you have comprehensive care, if you're on a family plan and it meets certain criteria, and you can see the criteria outlined on our website, you will be able to waive out of this insurance. The waiver period starts July 1st. So in a few weeks, you'll be able to go through that process. The whole idea of the requirements to waive out are based on making sure that your student is completely covered for any health concern while they're here at WashU. We just don't want some unexpected thing to derail your whole experience and have to, with big bills. And so you will go on our website, you'll see the criteria. If you have comprehensive care, that you can waive out of this insurance. And it won't matter what insurance you have. If you stay on your parents' insurance, you stay on this particular, your own, or the student health insurance plan, we will see you at Habif. We really consider every student at WashU our students and our patients. So next slide. The last thing, just a few things. HIPAA, I'm sure you're all aware, if once someone turns 18, we cannot talk to you as their parents without their written permission. And there are release of information forms on our website that can be filled out. And we, if your student wants you involved in your care, we're very happy to have you involved. But we really do, it's a tough thing. It's going to have to start kind of having that transition. We really want students to be able to come to us and be able to talk to us about anything and know that it's confidential unless they give us permission to share that information. The only times where that isn't necessary is if it's a medical emergency. We can't reach, it's a student is unconscious, we're sending in the emergency room. Of course, we're going to reach out to you to let you know that as well. So in an emergency is when we wouldn't need permission per se. We really do try and keep you involved. I know as a parent of 3 now that I've launched and have gone through college, it's a little bit scary and it can be frightening to think that your child is out there, but we really are here to take care of them and have you involved in as much as they want you involved in their care. The last slide I think is up next, please. Or this mic slide. No, one more. There is a health and wellness fee that's not to be confused with our student health insurance. It's a health and wellness fee that's assessed by the university that goes to help various things, including Habif and CAPS, but also other wellness programs through Recreation Disability Resources, the Relationship and Sexual Violence Prevention Center, WashU Cares, which is a kind of a case management center. And that fee you see there is what the fee is for this next academic year. It's assessed each semester. What it helps in Habif particularly is our health promotion activities. There's a wellness suite at Summers Rec that it also helps, and the counseling that Dr. Brounk talked about that is students have without any cost to them. It is supported by that health and wellness fee. All right, I think we're done, Mimi, and we can think about questions. Is that right?
Yeah, that is all of the slides. Thank you, Tom and Cherie, for sharing all of that information. So parents and family members and students who might be on this webinar, feel free to start plugging those questions in. I've seen some come in as they were speaking, but please feel free to continue doing that. I'll go ahead and kind of kick us off with a question. A broad one, I know, kind of a big one to start with. But in general, in addition to those tasks we just learned about health insurance and immunizations that need to be done, and then the proof that needs to be submitted, what advice do y'all have for our parents and family members, something they can do this summer to help support their students with this transition into college in relation to their physical and mental well-being?
Well, I can take it first, and then I think I will ask Dr. Brounk to also weigh in, because I think certainly from the mental health perspective, you have much more insight into that, Tom. I would say there are some really important conversations to have with your student, and you will see something coming from Habif about that. I think it might be in next month. Maybe you may be better to answer that, but there is a booklet coming out from us where we encourage you to have conversations with your student about a number of topics, alcohol being one, consent for sexual activity being another. Have students know how to fill a prescription, get them to be familiar with what their health history is, what their family history is. Those are all things that are really helpful to do prior to that last moment when you're just about to leave them. It's good to have these kinds of conversations during the summer. Tom, I'll bring it over to you.
Okay, yeah, I could probably spend a whole webinar on this, so I'm going to keep it short. So we know that sleep is the number one of the top issues facing college students that can cause quite a bit of disruption, and it's the thing that tends to get short shrift because they've got all these projects and classes and friends and parties and everything to attend to. But it's very important that to the degree possible, that even if it's not something where you can get 6 hours of sleep in one setting, as long as you are taking naps, cat naps, in 20-minute increments to sort of catch up with your sleep, that will count. So try not to do that, even though can feel like there's not enough time in the day to get everything done. If you aren't putting that energy into yourself, then what you get out is it's sort of like running a car on empty. The car doesn't run, even though the car is perfectly able to move. It needs the gas. So that'd be one. Two, I would say, as a parent, trust your gut, particularly as you're talking with your student and perhaps they don't sound the same or they sound just different, and it might be over a period of a couple of weeks that you're noticing some sort of shift. Trust your gut there. If they don't seem like themselves and there's just something that feels off, then please reach out. We're always glad to consult with a parent about maybe how to help a student get the help that they perfectly well deserve. And we can come up with some creative ways of being able to maybe access resources. Sometimes I call it using the backdoor method, where a student maybe won't come in to talk to a counselor, but they might go in and talk to a doctor about some headaches they're having, or some loss of appetite, something like that. And lastly, we know that everybody is feeling anxious or uncertain during those first few couple of weeks. That is normal. And whether you as a student can help to normalize that for yourself and maybe reframe it as maybe just, I'm really excited. I'm really wanting this year to go well. This is a really important time for me. Those are all really healthy ways of sort of taking that experience of anxiety and reframing it. And obviously, the more that you can, as a parent, be helped to normalize that everyone has these butterflies. Everybody has got those same types of questions. You're not alone.
Thank you both for those answers. I know that was kind of a very broad and it could be covered by a lot of different suggestions and pieces of advice, but I appreciate both of those answers. And we'll go ahead and move on to the remainder of our question and answer portion of the webinar, questions that have been submitted by our attendees. So the first one, we have a few that came in specifically about health insurance, whether it's the university's health insurance or their own individual or family health insurance plan. So the first question is, where can they find more information about the on-campus and off-campus services that are offered to students that opt out of the student health insurance plan?
Well, first of all, just to be clear, if you opt out of the student insurance plan, we are still very available to you. We will see you at Habif. We will still consider you part of our primary care catchment, and we will work with your insurance. And that's why there's waiver criteria, so that we know if you have waived out, you've met that criteria, which means Habif, WashU, Physician Network, Barnes Jewish Hospitals, all in your network. We will continue to see you. You might, Marissa or Mimi, just in the chat. Sorry. Not what I wanted on this recording was my dog. So Tom, I'm going to turn to you and see if you might want to add in until I get my dog settled down. So sorry, everyone.
And I know in the chat earlier, we plugged in the a link for the student health insurance waiver process. So there's probably more information on that page as well.
But there are, again, we're not open 24/7. There certainly are other, there are other area medical places to go to. There's urgent care centers not far. But again, we really try and want you, regardless of your insurance, to consider Habif your home. And we'd be happy to try and connect you to whatever you need.
And then I know in your answer, you mentioned the health insurance coverage criteria or a few pieces of that. And then also the health insurance waiver process. Are those mapped out on the Habif website as well, more specifically?
Yes, they are step-by-step instructions. It's all there. So I encourage you to spend a little time on our website, just clicking around to get that information. To know, though, that the waiver process doesn't open until July 1, so you won't be able to do that process until after that date. But once we're into July, it's very clear on the website on how to do that.
Great. And then I know we just had a question to come in about when the coverage runs. It sounds like it's August 1 to July 31.
Yes, it is. And it's important to remember that every year it's a yearly process. So every year you'll need to waive out if you stay on your own insurance, or you will be automatically enrolled each year. And it does. August 1st to July 31st is the time period.
Thank you. Okay, we'll move to a question about mental health. So we had a parent or family member ask if we could share the process and costs, or maybe where to find that information for students to access a counselor or therapy services through WashU.
Okay, so it sounds like they are asking about the options right on campus when you talk about through WashU. Okay, so the first 9 visits of counseling, there is no cost. So that part of paying that health and wellness fee that all full-time students pay helps to provide that type of service. So a student does not need to be concerned about costs if they're seeking services right here on campus, and that's to speak with a counselor. On the psychiatry side of things, that's a little bit different. It would depend on the insurance that you subscribe to. If you do elect to purchase the student health insurance offered through the university, and it's a $10 copay. There are no deductibles. And it's actually, quite a bargain when you think about it and the options that are out there. If you have your own personal insurance that would be used, then it would just be whatever the whatever the standard copay to meet with the psychiatrist. The specialty services usually is what it's considered, and then we can charge the student that copay directly to their student accounts. They don't have to be worried about writing a check or putting it on a charge or anything like that. So we can take care of all of that right here. It's about finding resources off campus. Again, then it'll just be utilizing the applicable insurance. We do have a care manager here at Counseling and Psychological Services Center, whose main focus is to help a student find resources, whether that's on campus or off campus. So that is something to at least be aware of. Oftentimes, she can assist a student in understanding their insurance, how that works, and keeps abreast of all of the different waiting times to be seen off campus, or the particular expertises that a student may be requesting that aren't being offered here at the Counseling and Psychological Service Center.
I'll just jump in real quick for a clarification. That co-payment of $10 is only if you're seeing someone at Habif. If they're seeing someone outside of Habif, the co-payment for the student health insurance plan is $25. And there is a deductible, it's $350, so we waive it at Habif. So again, if you're seeing anyone here, either in Tom's department, Counseling and Psychological Services, or anybody on the medical side, that deductible is waived. But if you're seeing someone outside, and it has caused confusion at times when students say, I don't understand why I have this bill, it doesn't look like anything was paid. It's because there is a deductible like there is on many insurance plans, and you need to meet the deductible outside of Habif before the insurance kicks in. So just wanted to clarify that in case there was confusion. Thanks.
I'll also mention that if you're considering, what are the pros and cons to sticking with your insurance or getting the student health insurance. I know, sitting with many students across from me, that one of the greatest barriers to a student getting access to the healthcare that they are in need of is concern about for better or for worse, parents finding out about their accessing the mental health benefit. There's a lot of improvement. We made a lot of strides in decreasing that stigma, but I can tell you it's still out there, it still exists. One of the advantages to the purchase of the student health insurance offering is that students actually do own that policy. And so the explanation of benefits will go to the student. That's the way the plan is set up. And sometimes that can make a difference with a student feeling comfortable enough to be able to make use of their insurance benefits.
And Mimi, I'm going to jump in just for one quick sec to remind people that what Tom has said is that this insurance plan is in the student's name. And so it's important, students, if you're on this call, and parents, to remind your students to, if they get an email from the insurance plan that there's something that needs to get done, to try and pay attention to that, because there are consequences when things don't get done when you're in the insurance world. So again, all communications go to a student, and you all are not used to this kind of information coming to you as students, because you'd be under your parents' plan up until now. So please pay attention to those emails, and parents, if you can remind your student, if they stay on the student insurance plan, that they need to be on the lookout for those and to respond to them if they get it. Thanks.
And then I know we started talking a little bit about payments. We did have a question come through asking if students need to pay bills at the time of service, or can their parents be billed afterwards? And I would say, let's go by the students on the university's health insurance plan is my assumption for the question.
So co-payments, regardless of the insurance, can be billed, as Dr. LeBlanc said, to the student insurance, or not to students, to the student account. So you will, as a parent, you'll see that on your student account bill each month if there's been a visit that's been charged to that. So you don't have, the students don't have to pay upfront for anything. So if they don't have a credit card, they forgot something, they just tell us, I want it billed to my student account, and that's how it's done.
Okay, we now have a question about transferring prescriptions from their local area physician, if it's outside of St. Louis, to one in St. Louis or on site at Habif for that quadrangle pharmacy. Can you tell us a little bit about the best way and maybe when to start that process?
I think you can, I would start it probably at least by August. There is a form on our website if you go to the pharmacy page that you can fill out to get your prescription transferred. What I will say, you know, we're happy to have any prescription transferred into our pharmacy. I just think you need to remember our pharmacy is located within Habif, which means its hours are our hours, which means we aren't open on weekends. So it's sometimes it's just a little tickler reminder that we're not CVS that's open every day of the week. But that's how you do it. I would start in August, early August, get that transfer over. And that, again, is an easy way for students to get their prescriptions. It's right there within our center.
Our next question is about physical therapy. And a parent or family member is wondering if Habif specifically, or maybe broader WashU, provides physical therapy for students who are recovering from surgery, have chronic illness, or really any other reason they might need physical therapy. And how does someone get an appointment for that?
So WashU does have a physical therapy, a very strong physical therapy department that's run out of the School of Medicine, but they do have a satellite clinic on our campus just down the road from Habif. Physical therapy is you know, you need a referral for physical therapy from a physician's office, and we're happy to do that if it's, you know, we see students all the time with strains and sprains and injuries. We refer them to physical therapy. It's just a few doors down the street. So that's how you get it. You have to, you know, it is something that you need a physician or a healthcare provider's referral for. But there is a convenient location here on the Danforth campus.
Thank you. Next question is about specifically self-defense classes. If Habif provides self-defense classes, or maybe that's more something under WUPD if that exists on campus, but we have a question about that.
I think WUPD still does that. Are you aware, Tom? I don't know.
Yeah, I believe so. I think maybe Marissa or Rupert could do a quick Google on that and check that out. But I know that in years past, they may not do it as a standard, on a standard schedule, but I know as needed, they have certainly provided that type of education to staff as well as to students.
We have a follow-up question for you, Tom. I know you mentioned about the 9 sessions that students can do on campus with a mental health counselor. A parent or a family member asked if students are able to see the same mental health clinician for each visit, or does it change, or what does that normally look like?
Yes, so when the first meeting with a therapist, we call that initial consultation. It's about 30 minutes. And over the course of those 30 minutes, the clinician is trying to get a sense of how can we best meet the needs of the student here, or do they would they perhaps best be served by finding an off-campus clinician. But if we decide that counseling here, and when I say here, I mean either face-to-face on campus, or we also provide hybrid, Zoom types of HIPAA compliant Zoom meetings with students as well. If we decide that the service will be provided by us, then that's going to be a regular appointment. Typically, it'd be every couple of weeks. If we're talking about somebody wanting to be seen on a semesterly basis, and it would be the same counselor that they would be meeting with. In some cases, students may actually research our therapist bios, who are they're all listed on the website, and they can specify or request a specific clinician at the time that they're meeting for that initial consultation. Sometimes what that can mean is that there could be a longer wait, though, involved for that special request. So a student sometimes has to make a decision between, do they want to be seen sooner, or would they prefer to wait for that individual clinician?
Thank you. Okay, so this question, we have a few more kind of going back to the health insurance plans and their coverage. So if a student needs to seek care outside of the St. Louis area, but they are on the WashU student health insurance plan, can that still cover that service?
Yes. And so again, anything outside of 20, I think it's 25 miles from St. Louis, do not need a referral from us. It's actually an international plan. And that's the beauty of that plan. So certainly what it covers while you're at home for the summer, you can see them. Again, you'll want to research who you're seeing. And because if you're seeing someone in the network of that insurance, a student insurance plan, it will be better, better serves you financially. But that is certainly available.
And we have a few different situations that people are providing, but kind of the general question is, if a student originally opts out of the student health insurance, are they able, due to maybe a change in their family situation or a different time frame of that insurance, if that insurance is a calendar year, are they able to join the WashU health insurance mid-year?
So if there is a change in status, you are able to join on a prorated basis on when you join. It's just a matter of reaching out to us, and we start that process for you and work with the United Health. But yes, if for whatever reason, your own insurance changes and we call that a change in student status, people can opt in at any time.
Thank you. Okay. So we had a question submitted asking about students who might be in a mental health crisis or they need services, but the services on campus are closed. I know you spoke about a few resources, Tom, earlier in the presentation. Can you kind of just re-go over those and maybe which one you might recommend the most for a student in crisis?
Yeah, so there's varying levels of crisis. First of all, if it is a life-threatening type of crisis where a student really, you have concerns, or the student is expressing concerns to their friends that they have means and access to harming themselves, and they're thinking about doing that, then the option there is to call our Washington University Police Department. They actually go through a very week-long intensive course. All of our police officers do that, are focused on responding to mental health and sexual assault and very sensitive types of responses that are necessary. So they're very well qualified to deal with these types of concerns, and they will send an officer who will supportively intervene and figure out what the student best needs, if they need to be transported to the ER for a more comprehensive evaluation, if it's a very urgent concern, or if this is something that could wait until the next day, until we're open. They are coordinating both with our timely care service, which, as I mentioned earlier, there's this feature called Talk Now. So if a student is experiencing really anything short of a life-threatening event, the Talk Now service is set up to be able to provide a response to a student. Typically, their average wait time is about 5 to 6 minutes, and it seems like that they're really have been able to adhere to that. And they'll talk with somebody who will develop a safety plan for that student in the course of that conversation. This can either be a phone call with the timely care professional, or it can actually occur via their phone, via video call, or they can do it certainly over their computer as well. So it's not only talking to somebody, but they're having visually able to assess the situation as well. If in the course of that conversation, that timely care professional decides that really this does need to be further assessed in person by somebody that is well qualified to be able to do this, and they will make a referral for the student to be seen. Typically, it's going to be over at the Washington University Medical Center. They'll arrange for transportation through our Washington University Police, who can send an unmarked car. This does not have to be a really public, visible type of transportation. Our police work very, very carefully to do this as sensitively and as privately as possible, but they can help the student then get to that in-person evaluation. If it's something where we are open, then that student would simply be instructed or escorted over to Counseling and Psychological Services, which is housed right at the Habif Health and Wellness Center, and we can take it from there.
Thank you for that. I did see a question come through about immunization requirements. We have a link for you in the chat. If you scroll up a little bit, that will help list that out for you. And then just a note again, as Cheri said, that will be, I believe, updated online July 1. The language will be updated as of July 1, noting that the COVID-19 and the flu are no longer required, but still strongly recommended. Okay. And then we have a few different questions specific to student athletes. If there's a, I guess, plan recommendation you have for them, if you recommend they use the university one as their student athlete, and then if their physical therapy would look any different, if you all happen to know that. And if not, we can probably direct them to athletics.
I would direct them to athletics, because if you are a varsity athlete, there is a very different plan, different physicians. We don't treat injuries that have occurred during, on the field during varsity play. So there is something that's very different, and the NCAA has rules about insurance and what's covered. So I would say athletics is the best place to get those answers.
Yeah, so if your student then is a student athlete, I'd recommend that they reach out to their coach and ask them about that specifically. Okay, we now have a question that's asking for a little bit more information about the HIPAA waiver, specifically if a student is under the age of 18. So how do HIPAA waivers impact students under the age of 18? We'll start there, and then I'll move on to the next.
Sure. So a student under the age of 18 is still considered a minor, and we would be calling you as the parent each and every time we see the student before we start any kind of therapy or any treatment, because we need your permission as the guardian of that minor. So under 18, there's nothing to fill out. There's no release of information, but overnight, once their birthday occurs, it changes. So we have many folks who start as minors and at some point in the year turn 18, and then that's when those things would take place.
And then the follow-up question was those who are over the age of 18. Does the university accept medical power of attorney in lieu of HIPAA waivers?
Yeah, there seems to be a fair amount of confusion over power of attorney versus a release of information. We don't really call them a HIPAA waiver. We call it a release of information that the student is giving us permission to speak to you. Power of attorney is something that certainly if someone is incapacitated, that gives you the right to dictate their care. But if someone is incapacitated, we will reach you. You don't need a power of attorney for us to reach you. If your student is unconscious and they're on their way to the emergency room, something catastrophic has happened, we are reaching out to you. The university is reaching out to you to make sure that you're involved. So you don't actually need a power of attorney for us to reach you in an emergency. That's where I think there's been some confusion. A power of attorney is really there for if someone is incapacitated.
Yeah, and I would just also add that the HIPAA release, we're glad to always work with families when the student gives their consent to do so. And those consents or those releases are on a per condition basis. So when a student does, let's say they're coming in for a mental health related issue and they want us to talk to you about their depression. We're glad to do that. The student would need to then sign a release that allows us to have that conversation. But it's not as if then that student signs that release and then they can expect to be able to come in and talk about their medical issue. It's a per condition basis that students are signing the releases. They can't just sign one form and say, I give permission for you to talk about anything and everything. That actually wouldn't be something that we legally could honor.
And there are two separate forms, is that not right, Tom? One for your department when you engage in therapy with a student, and there is a release.
Yeah, we're working on that. That's a work in progress. Right now, it's a unified form.
Okay,
Yeah.
All right, and that form is found on our website.
Yes, it is.
There's a link, I think, on the front page under forms, and there's a separate page within our website that talks about that. And I think I saw it, someone put it in chat.
Thank you. Okay, so our next question is back to mental health check. So if a parent or family member, or let's say a friend, is concerned about a student, how can parents, what do you recommend they do to request a mental health check, or how should they go about informing someone at the university about their concern?
Sure. So most directly, we call it a welfare check, and it is our university police that would be the ones that would be in the best place to be able to do that. So you could call our university police at that 314-935-5555 number, explain the situation to our dispatch, and then our police will then be sent to check in and see what's going on. Do they need assistance? Do they need transportation? Or is everything maybe okay? Another office that if you don't want to call the police directly, but you just want to get this student perhaps on the WashU radar, so to speak, it would be our most likely our WashU Cares service, which Dr. LeBlanc briefly mentioned at the outset of the webinar. So they are charged with really helping students in a case management role. So it could be a whole number of different types of issues. It could be for some students it is food security issues. For others it could be there's concern about their not immediate concern, but they're concerned about their well-being, just how they're doing in their coursework. They're sort of the catch-all for any type of concern, and anybody can make a WashU Cares report. Then they will actually call the student, follow up with them, see if there's anything that their office can do to assist in making a connection for them with financial aid, opening up lines of communication where perhaps the student has felt shut down or like they don't have a place to turn. But it'd probably be through those two offices. some cases residential life. You could also call them if they are living on campus with residential life. It's the residential life. They call them the residential college director, who you would most likely be wanting to reach out to and say and express your concern.
I don't know if one of you can put Wash Your Care's website in the chat. It's separate from Habif. It's not run out of our either one of our departments. So it is a separate website that might be helpful for families to take a look at.
Yes, we can definitely add that. Okay, so our next question is about urgent care centers in case students need care when Habif is closed. How close and accessible are other options? Specifically, urgent care centers is named in this question for students.
Yeah, there is what's called a total access urgent care, which is a common kind of brand of urgent cares here in St. Louis. And there is one located on the corner of Big Bend and oh my God, I'm blanking. What is it, Tom? Help me.
Big Ben and Clayton.
Clayton, yes, which is really kind of kitty corner to the edge of our of the South 40. So literally within several blocks, there is a total access urgent care, which is open 8 to 8, 7 days a week. And so that's probably the closest one, pretty easy. Though again, the timely care version is a good option for students. They will tell them in a virtual meeting if they feel like actually that you really do need a physical appointment, and they can direct them. But if it's something that could be taken care of in a virtual visit, we do have access to timely care's notes after every morning. One of our nurses reviews those, where it's a little tighter connection and we're able to do follow-up a little easier than just an outside urgent care. But there certainly is one not far from campus that people can access.
Thank you. Our next question is about specific groups or workshops or services that are provided for students who are recovering from a variety of things. And I believe some of these might have been on the health promotion slide, but specifically if they're recovering from substance abuse, if they had some form of disordered eating disorders, any type of stress reduction. So kind of a wide variety. But where can parent, family members, and students go to learn more about different services for those different, needs or specific populations?
Yeah, so if someone can put in our health promotion page, our landing page then goes through all of the different resources that are there. There certainly is a recovery group that is run out of health promotion, and our alcohol and other drug educator is in charge of that. But there are multiple resources from that website that I think is easy enough to plug into.
Thank you. So we're going to ask one last question for the evening. Panelists, thank you again for all the information that you've shared tonight. What health and wellness related conversation do you think families should have over the summer? If you had to pick just one, I know there's a whole list of them, but if you had to pick one to really encourage, if they only had time for one this summer to prepare for the fall, which would you pick?
I'm going to let you answer that, Dr. Brounk, because I think yours is the more important one, honestly.
I'm going to go with something really general, just about, we're here for you. We, as if we're talking about a parent wanting to leave a message is, don't feel like you're ever sort of stuck out there without somebody that wants to listen, that wants to be helpful, that is there for you. I don't think that message can be sort of overdone. And because it's probably when a student's perhaps least likely to want to talk or want others to know about the struggle that they're having, when it's that type of message that's going to matter the most. They don't have to do it all alone. We've got so many resources here and so many people that really genuinely want to be of assistance. That's the whole reason Student Affairs exists. The Division of Student Affairs is to try to be supportive, and just don't feel like you have to have the answer, but know that there's a whole host of people really a phone call away that can help you to figure out, what to be saying or doing, the conversation to be having. So yeah, just we're a team.
I like that. I think I would also add that it would be a really great conversation to have, sharing some of your own setbacks as you started out in college or in your early in careers. I think students, certainly some of the students that I see, feel an incredible amount of pressure to succeed, and perhaps getting into an institution like WashU, they've not failed at anything before. And so there's going to be setbacks, because that's normal. And sometimes it's just really helpful for a student to hear, this is what happened to me when I first started, and just to know that you are there for them, I think is really important for them to hear as well before you send them off.
Thank you both. And I know Cheri mentioned this earlier, but there are some more recommendations in the Habif Health and Wellness Guide that shall be reaching mailboxes, if it has not yet, very soon. Panelists, the information you provided this evening was very helpful. I'm confident families of WashU have been able to learn a lot more from your presentation, and I hope parents and families that you gained some more valuable information tonight. Stay tuned for our next webinar, which will be in 2 weeks. It's a conversation about combined studies occurring on Tuesday, June 27th at 5:30 p.m. Central Time. You can register for that webinar and then find a recording of this webinar at families.worcester.edu. We will see you all then, and thank you again. Bye.
Thanks. Bye-bye.